Our chat today will be focused on 4 key areas of healthy living: managing stress and anxiety, diet and healthy eating, metabolic response to interventions to diet, and physical activity. I'm one of 4 panelists today. We're all from different institutes at the National Institutes of Health, here to answer your questions. Ask them in the Periscope screen or on Twitter using hashtag NIH Healthy 2018. I'll introduce myself and then we'll go around the panel. I'm Dr. Nicastro. I'm a program director at the National Heart, Lung, and Blood Institute, and I'm a nutrition scientist. And I'm here today to answer your questions about diet and healthy eating.
I'm Dr. Jerome Fleg. I'm at the National Heart, Lung, and Blood Institute also. I'm a cardiologist, and I have a strong interest in exercise, physical activity, and I'm here to answer questions on those topics.
Hi, I'm David Sommers. I'm a review officer at the National Institute of Mental Health. I am a clinical psychologist as well, where I see patients.
And I'm Dr. Kevin Hall from the National Institute of Diabetes, Digestive, and Kidney Disease, where I'm a senior scientist who investigates diet and obesity.
Thank you, Dr. Hall. It's great to have everyone here today for the NIH Healthy 2018 Periscope Live. If you're just joining us, the 4 of us are from institutes across NIH to answer your questions about how you can be healthier in 2018. Let's get started. The first question is, thoughts on intermittent fasting and the 5-2 versus the 16-8 every day?
Yeah, it's an interesting question, very popular topic these days about intermittent fasting. There's all sorts of different variations on this theme. I'd say that the research is just really beginning in humans about the effects of intermittent fasting. There was a couple of very interesting papers published last year from Krista Verity's group comparing folks who were prescribed intermittent fasting, I think it was alternate day fasting, versus just consistent calorie restriction. And on average, I guess if you're a proponent of intermittent fasting, the results were a little bit disappointing. There was no substantial difference between the 2 groups of people who were randomized to these different interventions. However, within each group, some people were remarkably successful, for example, with weight loss, whereas others weren't so successful. And I think one of the main outstanding questions that we have is, what is it about some people that seem to be much more adherent to one type of dietary intervention over another? And I don't think we really know the answer to that question yet.
I think if you are one of the people where intermittent fasting does work for you, you just have to make sure that you're not eliminating entire food groups or getting into any nutritional deficiencies. Okay, the next question. With all the new fads, it's sometimes confusing to figure out what the best diet or exercise routine are for any one person. And I think that's correct. When deciding the best diet or exercise routine for you, you want to make sure that it's flexible enough to fit your lifestyle, your likes and dislikes. You want it to be science-based, so you want to know that they've done studies to look at the outcomes you're looking for, whether it's reducing cardiovascular risk, losing weight, etc. Anything to add on physical activity?
I think the best physical activity routine is one that you're going to stick with. And so you should choose something that you like, or at least that you don't dislike, and something that's not too hard for you to put into your routine. If you don't have a swimming pool access, obviously, doing something like swimming daily is not going to be practical. So it should be something you like, something practical, and something that you can make really part of your everyday lifestyle. And in fact, scheduling a time for physical activity is one of the ingredients for success in terms of sticking to it.
Yeah, I think that's probably true also for diet as well. I mean, it's no sense in kind of starting with a diet that's going to be extraordinarily difficult for you to sustain over the long term. You should choose something that's healthy and that you can sustain over the long term. Otherwise, whatever benefits you might see are going to be as transient as your adherence to that program.
Right, so this is not my area, but it's clear from what everyone is saying, there's no one-size-fits-all.
Okay, the next question. How do diet and exercise affect cardiovascular health? Would you like to start with exercise?
Do we have an hour and a half? Certainly for exercise, the effects are multiple. It improves several of the cardiovascular risk factors. We're talking mainly about aerobic exercise, things like running, walking fast, swimming, cycling, because these make the heart rate increase much more and breathing rate much over normal rates. These aerobic exercise tends to reduce blood pressure, improve glucose tolerance, helps to reduce depression, obviously burns calories, so helps in weight control. So those are multiple risk factors that it addresses, all of which, if you reduce those risk factors, are going to lead to lower rates of cardiovascular disease.
So what about weight bearing for things like bone health, osteoporosis?
Yeah, bone health as well, right.
So weight bearing would be?
Yeah. So if you really focus on the bone aspect, then you would want to do weight bearing exercise. Probably would not want to do cycling or swimming, but preferentially do something like, you know, running, walking fast.
And this is a very important question because cardiovascular disease is the leading cause of death in the U.S., with 1 in 4 deaths being from cardiovascular disease. On the diet side, we just learned for the 8th year in a row, the dietary approaches to stop hypertension diet, or the DASH diet, has been named the #1 diet by the U.S. News and World Report for the 8th consecutive year. This diet emphasizes fruits and vegetables, whole grains, low-fat dairy, plant sources of protein, lean meats, and it cuts back on fatty meats and added sugars. So this diet has been shown in studies to lower blood pressure, to decrease bad cholesterol, or the LDL cholesterol, and other NHLBI studies have shown that people can lose weight and lower their blood pressure while on this diet. Okay. So the next question, will cutting carbs and adding protein help me lose weight?
Maybe I'll start with that one. So we've done a lot of research on low-carb diets versus low-fat diets, and generally speaking, it looks like, yeah, if you cut carbs and add protein to your diet, chances are you will lose some weight. I think that one of the key factors is whether or not you can sustain those changes over long periods of time. There are some people who might respond quite differently, and I think that one of the things that we know is that that when you focus on these individual macronutrients like carbs, fat, or protein, in the absence of thinking about other aspects of a healthful diet, that might be detrimental in the long term, because you can devise a very, trashy junk food-like diet that might be low in carbs and high in protein. It doesn't make it necessarily good for you or sustainable. But for the most part, you can achieve weight loss with a variety of dietary patterns. Low carbohydrate and higher protein diets tend to do better over the short term, but over the long term, very little difference, actually.
Great. The next question is, what cultural components should we keep in mind with regards to dieting and exercise? So I'll start. You're probably noticing a theme here that whatever plan you're going to decide on, it has to fit with your life. So, and that includes your cultural beliefs and the foods you choose. So if a diet calls for foods that you don't like or that don't fit with your beliefs, it's not going to work for you.
With regard to exercise, I actually have some experience with the Native American community because I've done some research out there, and they've been trying to introduce running because it was part of their lifestyle 100 years ago, but because of automation, there's a lot less physical activity, and I think a lot of these things are certainly society-based, and we have to really make a conscious effort in the day of computers and television and everything, automobiles, to make time in our day to do things that involve physical activity. So it's cultural, but it's really, I think, to a larger extent, it's societal. It really permeates just about all of our societies, and it is an issue that we need to deal with consciously.
Excellent. The next question. I read that combining the DASH diet with low sodium is really much better than DASH alone to lower blood pressure. Is that correct? And what about DASH alone? So this is correct. In an NHLBI funded study, they showed that the DASH diet alone lowered blood pressure, as did reducing sodium in the diet. And when these two were combined, when the DASH diet was combined with the lower sodium levels, they saw the greatest reduction of all. Moving on, do you have any positions on whether saturated fats are as unhealthy as they've been characterized?
Want me to start? Sure. I guess the real question is compared with what? And I think that there's been a variety of interesting epidemiological data, especially recently, coming out to suggest that, well, certainly if you compare saturated fats versus trans fat, it's not nearly as bad as trans fat. Trans fat's definitely worse than saturated fat. But if you're comparing, replacing saturated fat with refined carbohydrates, for example, it actually might be neutral. But if you replace saturated fat with polyunsaturated or monounsaturated fatty acids in the diet, that seems to have a net beneficial effect, at least according to my reading of the literature. Holly, you know a lot more about this than I do, so maybe you can
Exactly, particularly as it applies to cardiovascular health. Replacing saturated fats with unsaturated fatty acids can have good cardiovascular benefits, including on blood lipid levels. So the next question, you mentioned diet and exercise, but what about sleep?
I don't think any of us here are sleep experts, but at least from the reading of the literature, certainly either particularly sleeping too little is associated with high stress levels and even adverse metabolic effects. And so I think that the general guidelines are that for most people, somewhere between probably 7 to 8 or 8.5 hours of sleep a night is really what the body needs for most individuals.
And inadequate sleep can hinder adherence to a dietary plan as well as weight loss.
Yeah, a lot of people don't eat while they're sleeping either. So it's at least a period of time where you can block out where you're not generally going to be eating. So.
Right. Well, sleep as it relates to weight loss, if that's the topic, and exercise. I mean, there is a relationship there. There's a profound relationship between sleep disturbance and many things on the mental health spectrum. What we probably don't know is necessarily which comes first. We often think of it as a chicken-egg type question. But we do have interventions that work without medication to help people who are having trouble sleeping get better sleep, get a better quality of sleep. If anyone's interested, we have something called cognitive behavior therapy for insomnia, CBTI. There's a lot of evidence to support that it works. Interestingly, when it's delivered in person and face-to-face manner, also when it's delivered via the internet and by smartphones, which is a growing field of research for us.
Yes, and I can point people to the National Heart, Lung, and Blood Institute's website, nhlbi.gov, for more information on resources related to sleep. The next question, why do I still hear about disparities in heart disease affecting African American and Hispanics more than other groups?
I guess you keep hearing about them because they really do exist, and I think we've overlooked these. We've tried to have kind of a one-size-fits-all approach in terms of, cardiovascular health, and both African Americans and Hispanics have high rates of heart disease, a lot of which is probably culturally related. High, for instance, in the African American community, obesity is much more prevalent, particularly in African American women, which leads to greater incidence of hypertension, lipid disorders, diabetes. So these are major issues. The American Indians also have an inordinately high rate of cardiovascular disease. So these are groups that, over and above the general population, really need added emphasis in terms of how to reduce the risk factors that basically lead to these higher rates of cardiovascular disease.
The next question is, my parents are getting older and it seems like they're having trouble remembering things. How do I start the conversation with them about Alzheimer's, dementia, and getting the care they need for the future?
So this is a very difficult conversation to have. There's probably no question about that. I would also say that there's a certain amount of memory loss that occurs that doesn't necessarily imply the early stages of dementia or Alzheimer's, for sure. So one thing to keep in mind is it's a question of timing, and I would say it's a question of watching the progression. So if they're forgetting a couple things here and there, it may not be a problem. May not be a problem, and it might be important for you to sort of manage your own anxiety and stress about what's happening with them. I don't know how old your parents are, and but that's almost independent because people can have early signs of this or more typically later signs. Starting to have the conversation when you think the time is appropriate is you just have to start it at some point about planning for the future. There's no easy way to do that. But I guess what I'm trying to say is you may or may not be there at this point. There are plenty of resources out there. The National Institute of Aging has resources. The NIH website is a place that you might look. There are a lot of things like elder care support and support groups and agencies in most communities at this point. That might be another resource.
The next question is, how do I manage stress and especially anxiety without medication?
So interesting that we're talking a lot today about the value of exercise for things like cardiovascular health and general well-being. There's a lot of answers to this question, one of which is exercise. We actually have evidence that aerobic exercise can reduce both depression and anxiety. I am myself a big proponent of things like yoga, like meditation. We have what I would call traditional psychotherapy. I mentioned cognitive behavior therapy. A lot of evidence, overwhelming evidence that it can help with managing anxiety. There are many ways, and I think, and the other thing to talk about as well is mindfulness, which is related to meditation. We're accumulating evidence on the value of doing this. I would suggest that you look at something called MBSR, mindfulness-based stress reduction. There's a lot of literature that supports how this can work to help with reducing anxiety. And once again, there's a lot of things that you can access on the internet and also a lot of apps that you can run on your phone. All of which are evidence-based at this point in time. And I happen to think, I think we all do, that that's important.
The next question is there a difference between optimal diets according to youth and adolescence and adulthood? This is a great question, and I think it's something we're just starting to explore. First, when we talk about optimal diet, that will mean different things to different people. It depends on your goals. Usually in adulthood, we talk about optimal diet in prevention of chronic disease, but it can also be talked about in terms of weight loss or maintaining a healthy weight. And now that we're seeing issues of obesity and metabolic disorders earlier into adolescence and childhood, we're starting to think differently about what an optimal diet for an adolescent and a child would look like. But on the whole, diets like the DASH diet and the Mediterranean diet, which really just use foods, common sense foods that we know to be healthful, they don't eliminate any major groups, and they're focused on plant-based diets and getting a good mix of carbohydrates, fat, and protein, are always going to be good bets no matter the age. Next, now that the helpfulness of coconut oil has been debunked, how do you feel about avocado oil, and what is the healthiest of the plant-based oils? So this person might be referring to the saturated fat content of coconut oil. A lot that's out there about coconut oil isn't necessarily evidence-based, but for right now, the recommendations, because of its high levels of saturated fat, we treat it like any other food that's high in saturated fat. As far as healthy oils, you need to think about an oil that you're going to eat. I've personally never tried avocado oil. I know that it's high in monosaturated fatty acids, similar to extra virgin olive oil, but I've never seen it in the grocery store, and I don't know how much it costs, so if it's not available, it's certainly not going to fit well into a healthy diet. If you like it, and it's high in monounsaturated fats, certainly eat it. I'm a big fan of extra virgin olive oil myself.
Yeah, I guess just to kind of support the evidence base, right? I mean, I think that the Predimed study is one of the only randomized controlled trials with hard cardiovascular outcomes that have basically one of the arms of the intervention was just providing people with olive oil to supplement their diet. And it showed a beneficial effect. So if you're asking about what the science-based is behind a plant-based oil, it seems like olive oil's got to be somewhere near the top of the list.
What does it mean that sitting is the new smoking? Is inactivity throughout the day so bad if I spend an hour in the gym every day?
Oh, this is a great question, because it is true that over the last decade we've seen a huge literature of studies, almost all of which are observational, people self-reporting how much they sit. And there's a strong association between, you know, high levels of sitting and increased risk of cardiovascular events. So in this sense, it's become a new cardiovascular risk factor similar to that of smoking, although probably not quite as potent in terms of its negative effects. The question about whether inactivity throughout the day is offset by spending an hour in the gym is also a great question. There's a lot less data on this, but certainly from what we know about the beneficial effects of regular, particularly aerobic exercise, clearly this is going to offset to a large extent any negative effects of the prolonged sitting. And what the optimal balance is, or how much exercise you need to do to completely offset it, we really don't know. I would recommend, though, that at the workplace, if you know that you're sitting during the day for 8 hours or more, or even several hours, that probably getting up every hour or so, taking a walk. As I'd mentioned previously, another question, using the stairs instead of the elevator, parking farther away than you need to, when you go into work. These are all things you can do that also will help to offset the negative effects of prolonged sitting.
Great. So I think we have time for one last question. If you have plateaued on your weight loss journey, how do you kickstart to the next level?
Great question. So one tool that we've actually developed to help people with weight loss is something called the NIH Body Weight Planner, which allows people to look at changes in diet and physical activity to reach their goal weight and maintain it thereafter. One thing that should be kind of made clear to people is that actually relatively modest amounts of weight loss is all that's really required to help improve your health and prevent or at least reduce the risk of diabetes and whatnot. So a lot of people might be disappointed that they've only plateaued at about 5% or 10% weight loss. And actually that's actually a success. And the last thing you should do is to give up whatever you've done to achieve that level of weight loss because it's actually has been beneficial for you. And so I think that one of the things that we need to kind of separate out is what a lot of people feel are some of the cosmetic benefits of weight loss, of which they tend to target very large goals, versus the health benefits of weight loss, which tend to actually occur with relatively modest degrees of weight loss. And so if you've plateaued at a relatively modest amount of weight loss and it's maybe far from your initial goal, I'm sure you can think about changing things up. But I would try to keep those sustained healthy behavior changes because that's going to lead to improvements in your health and well-being, even independent of the weight loss itself.
Great, thank you. Well, that's it for today. Thank you to everybody who watched the stream and sent in comments, and a big thanks to the fellow panelists. This video will be available on the NIH Twitter page shortly, and the NIH Institutes and Centers will continue to answer your questions on Twitter for the next few hours. The next topic for the NIH Healthy 2018 Town Hall is managing stress and anxiety. Follow along on @NIH using hashtag NIH Healthy 2018. Have a great afternoon. From the NIH family to your family, we're all wishing you a happy, healthy new year.